Dr. Nagel here, and our first myth that we're going to cover is a glucose level and or hemoglobin A1C adequate testing to measure the degree of disease progression when it comes to diabetes or it comes to insulin resistance? And obviously I disagree that that's adequate, and I'm going to get into a little bit of why that is. Not only do I believe that this is one of the reasons is very much inadequate, I also believe that this may be one of the reasons that diabetes only gets worse in our society today, number one. Number two, that the amount of people with diabetes is absolutely skyrocketing over the last few years, because if we did adequate testing, that the mainstream approach to how this problem is managed would have to change, okay? And so when we talk about this, right, a person might get oftentimes a person gets a glucose level until those glucose levels are high enough for them to actually be tested a hemoglobin A1C, and even that is very much inadequate. Now, what a glucose level is, so you might have heard of like a fasting glucose or a postprandial glucose, meaning after meals. What that is a level of glucose that's circulating in your blood, okay? In your blood alone. Now, what that means is, what that's an indication of is just that short term. That can change from minutes to hours, right, to even days and over long term, right? And so when we look at your glucose levels, right, it's obviously an indication of many different things, but obviously how much sugar are we eating, how much protein are we eating, a lot of different factors go into how our glucose levels are monitored, whether it's sleep, right? Sleep affects our glucose levels, stress levels affects glucose, exercise, activity, all these different aspects affect glucose levels. Now, when a person's glucose levels become high enough, and I believe that they should be tested a lot, that a hemoglobin A1C should be tested a lot sooner, because if we do a glucose level only fasting, we don't know what it's doing for the rest of that day. What a hemoglobin A1C is, it's looking at the lifespan of a red blood cell and how much sugar or glucose that it's been exposed to, okay? This number is important, right, because it gives us an idea, not just a short snapshot, more of a long-term snapshot. Now, there are some intricacies with the testing that a person should look at, right? The first thing is, how long are your red blood cells living, right? If they're having a really short lifespan, the amount of glucose they're being exposed to is going to be a lot less, right? But if they, and so looking at that question, and obviously there's, we're not going to get into any of that today. And then the next thing that we need to look at, right, is that glucose, the hemoglobin A1C. Now, hemoglobin A1C is associated with a wide variety of problems, okay? A normal hemoglobin A1C should be less than 5.6 to 5.5 would be ideal, okay? Or what we consider in our office to be normal, okay? Now, what I want you to understand is, if a person's diagnosed with diabetes, that medicine actually changes or changes what the expected number is of that to make it okay. Now, this is, it may be hard to grasp for you, but what they're saying is that now that you have a label of diabetes, we're gonna accept a worse number, even though this worst number has very high implications when it comes to everything from heart disease to cancer, right? There's elevated blood glucose levels, weight gain, heart disease, stroke, you name it, right? A hemoglobin A1C literally is very highly correlated with a term called advanced glycation end products. And if you want to look that up, right? I'm not going to get too much into it, but it's in it stands for the abbreviation AGE, age. That's literally what that's talking about. Advanced glycation end products speed up the aging of every organ in your body, okay? Everything from your heart to your skin, right? We talk about wrinkles, we talk about, you know, everyone wants to look young forever. Well, if you want to look young forever, have an ideal hemoglobin A1C, right? Obviously, among other things. The other thing that we need to look at, right, is even your spine, right? Spinal breakdown, degenerative changes of the spine, degenerative changes of all tissue, right, are associated with AGEs. So that number is really important, but as I said before, I still believe that that alone is very inadequate to assess how a body's managing blood glucose levels, okay? The next thing, right? The next thing, and the reason I say that it's so inadequate is the next lab, right? The next lab I'm going to touch on here is insulin, okay? Many people have heard the term, or maybe they're on insulin, or they understand that your pancreas makes insulin, right? And it makes it in order to, for a number of different reasons. Now I want to take a step back. The insulin is a hormone in the body that's designed to clear glucose from your bloodstream and to put it elsewhere, okay? The first place it goes is your liver, and it can only hold about a tablespoonful of sugar, okay? The next place it goes is your muscles and other cells, right? It'll fill those cells up and try to give them that energy, right? Now insulin, think about that, if we have a massive amount of blood glucose, right, it's trying to shove that insulin that glucose into the cells, right? So you need more insulin to do that job, okay? And I'm going to circle back to that in a second. The next thing that happens, okay, is the insulin is a fat storage hormone. When it can't put any more into those other tissues, it actually starts to spill over and stores it as fatty tissue. I don't have too much time to get into all the details of that. That could be an hours-long video with how those mechanisms happen, right? But when we talk about insulin levels, and we'll get into insulin resistance in a second here, insulin itself, if we think about how this works, okay? If we think about how insulin is designed to work, move glucose out of the cells, but what happens if for some reason, right, we have elevated glucose levels forever, every day, most of the time, all the time, and we live a lifestyle that basically exposes us, whether it's stress, whether it's lack of sleep, whether it's too much glucose or too much protein, or all these other factors. What happens is with time, right, our body, those cells stop being able to utilize insulin optimally, okay? Meaning it's going to take more and more glucose to do the same, to get the same effect, right, to lower that blood glucose level. I think of it somewhat like alcohol, like when we drink alcohol, okay? The more alcohol we drink, right, when we have our first drink, it doesn't take much insulin for it to do its job. As we expose our body to more and more alcohol through a lifetime, right, if we do it consistently day in and day out, it takes a lot more alcohol to get that same effect, that same physiological change, okay? The same thing happens with when we're constantly having high glucose levels. It's going to take more and more, your glucose levels go up, right? And then your insulin levels have to chase it, have to come up to bring that down to level again. Now what happens is, if this is always elevated, right, pretty soon it's not going to be as effective, that insulin, because the body has had enough sugar, right? And it starts to need more and more enough glucose. So what happens is it takes more and more insulin to do its job, just like it would take more and more alcohol to do its job, to get a buzz, so to speak. So when we think about that, right, and unless we're actually measuring insulin levels, I have yet to have somebody come into our office that is under medical care and to have an insulin level checked, right? There's very few clinics that actually look at measuring these numbers, okay? The reason, right, I want you to think about this. When we talk about insulin resistance, right, at some point those cells can't handle any more sugar, right? So we have all this insulin flowing through the stream and it can't handle any more sugar. Well, the pancreas is going to try to make more and more insulin to try to keep up with that. So if you would take a lab test, those insulin levels would be elevated, which is not normal, even though a person might actually have a normal glucose level. And so this is what happens like decades, like years before a person's ever diagnosed as a diabetic, is that insulin resistance or insulin tolerance is getting worse and worse while the pancreas is able to keep up. Well, what happens is at some point that pancreas can't keep up anymore with producing insulin, and so what happens is those blood glucose levels start to rise, okay, and they start to get higher and higher. Well, that's when we get a diagnosis of prediabetes or diabetes or all those fancy terms, right? Well, what's happening, and I don't have too much time to get into all this, otherwise we'll be here all day. But looking at that ratio of hemoglobin A1C to the amount of insulin in your body, those ratios are really important because that gives us an idea of what's called insulin resistance, that insulin resistance going on. Again, I've yet to have somebody actually have that tested. okay, before coming into our office. Now when we start to look at this, right, if we have it's a number called HOMO-IR, which is basically a ratio of your glucose to your the amount of insulin that your body's producing. Now, when we talk about that, right, the higher that number, the more likely that a person's going to be insulin resistant, as well as or might have what we call beta cell or pancreatic cell dysfunction. Okay. Elevated insulin levels are not only important to look at this, right? Elevated insulin levels are tied to virtually every chronic disease out there, right? And so when we think about that, right, we think about chronically elevated insulin, it's a growth hormone, right? So very closely tied to cancer, right? The more elevated insulin we have, and that's where you look at these different nutritional practices that minimize your body's response to blood glucose, or minimizes helps your body to manage glucose levels, are very much have shown in the research to actually be cancer preventative. Okay. As well as there's also specific nutritional protocols that can help to even fight off cancer cells, or if a person's doing chemo, to help the chemo or those things be more effective. Really fascinating world when you start to look into it. The next number, right, so what else can increase insulin levels? Adrenaline, cortisol, right? These things will all increase insulin levels as well. But just remember, many of the medications, and we're going to get into this on a different video, will actually give your body more insulin. And this is why I believe it's not tested, is because if we're giving medications that increase insulin release or actually put insulin into the body, those numbers are going to become more and more outside of normal. What that's doing is it's actually trying to cram that glucose into those cells that have already had too much. They're already at their fill, okay? And so the next number I'm going to get into, C-peptide, right? This is another number that's really important, and the reason it's important is as a person remains a type 2 diabetic for a very long time, and that pancreas has to work so hard day in and day out, what will happen is it can actually lead that pancreas to become fatigued and to quit producing insulin, okay, which would be what's referred to now as a type 1.5 diabetes, or an insulin, basically. Now they've become insulin dependent, right? So that's similar to a type 1 diabetic, which is an autoimmune problem that destroys those pancreatic cells, right? The pancreas actually produces that insulin, if I forgot to mention that, okay? Now, if a person, oftentimes what we see is if a person's type 2 diabetic for a really long time, right, they may have actually quit, their pancreas may have actually quit producing any insulin. And so the question is can some of that function be regained? And we know through the research, if you practicing the right practices, you can actually regain beta cell function, or those pancreatic cell function, for it to actually start producing insulin again. Well, C-peptide, what that number tells us is your pancreas actually producing insulin, okay? And so that gives us a really good idea of, do we need to look further, right? Especially if a person's been a type 2 diabetic for a really long time, do we need to look further if those numbers are off for maybe an autoimmune problem that has happened since then, that's actually destroying these pancreatic cells, right? And so there's actually additional lab testing a person can do called anti-GAD, or a couple other ones, anti-insulin antibodies, looking for different antibodies where the immune system is actually seeing these things as foreign products or foreign entities, and it's actually attacking that tissue, okay? Adenopectin. Now this one's a little bit more in depth. It's another lab test that we like to see along with leptin, okay? These two hormones are actually made by your fat cells, okay? And so it's produced by your fat cells, and it's inversely correlated to the amount of fat that we have. Basically, it helps regulate metabolism, glucose burning, even fat burning, okay? And I want to take a step, and basically what that does is it works synergistically with leptin to help maintain that insulin sensitivity. It actually protects your body, tries to protect your body from too many of these bad lifestyle decisions. So really fascinating. Leptin itself, leptin is the satiety hormone, meaning it tells your brain you're full, meaning you've had enough. And so many people just have these massive food cravings when they start in our office. And we can actually change. So looking at, and so knowing that, and you see it on paper, you know it's not your fault. It's not just a lack of willpower, so to speak, right? Yes, there's a certain amount of willpower when it comes to the habits our brain have created in regards to our food habits. But leptin itself is a hormone that triggers your brain to tell you that you're full, and it's actually produced by your fat cells as well. Now what happens is, if we're very much, there's a correlation between insulin resistance and how that body's working, but when we look at that, right, when we see a leptin high that's high long term, okay, meaning, or that's high in general, I should say, what that means is that how that feedback mechanism between your fat cells or your body and your brain, that feedback mechanism is dysfunctional, meaning the brain is no longer hearing that message, right, that I'm full. So the body is actually producing more and more of this hormone to really try to get that message through the brain to say I'm full. Okay, and so by normalizing, by helping you using various lifestyle factors and lifestyle habits, we can actually reverse those numbers and help to bring them back towards normal. Again, we're not focusing on the number itself, we're focusing on putting the body in an environment to rebuild health and rebuild how that body works. And we get to see those numbers normalize so often, right? The next number, high sensitivity CRP, okay? A lot of times this will be taken when somebody thinks that, when maybe their doctor thinks they have an infection, right? But what we know is basically looking, what high sensitivity CRP is looking at inflammation, okay? Meaning looking for the presence of inflammation in the body. What the data shows is, regardless of the cause, whether it's an autoimmune problem, whether it's an infection, whether it's, whatever that happens to be, really poor lifestyle choices, omega-3 deficiencies, what happens is, if those numbers are elevated, right, regardless of the cause, it increases, it's shown to increase risk of cardiac disease, metabolic syndrome, diabetes, right, heart disease, and all sorts of different degenerative disorders. And that's where oftentimes, and again, the question becomes, why isn't this being tested, okay? So just like I believe insulin isn't being tested because the tools being used to help with blood glucose levels, they won't help. In fact, they make insulin regulation worse, right? Same thing happens with high sensitivity CRP. If they don't have anything to actually address it, and they're not acknowledging that that's a cause of all these different diseases, they're not gonna, there's no reason to draw a lab test. So either it doesn't matter to them, or they don't want to know what it is, okay? And so that's where changing your lifestyle, we will see marked changes, right, in these different levels, right? And it's always fascinating to see. Doesn't happen overnight, takes consistency, takes commitment and responsibility, right? Another number, triglycerides, right? This, you probably have seen this on a cholesterol panel and think that, well, it's tied to cholesterol levels. But what triglycerides actually look at is when it's very highly tied, again, with heart disease and stroke and that sort of thing. But when we look at the correlation between triglycerides, oftentimes what it is it's a problem with how your liver is actually managing and metabolizing sugar, okay? Triglycerides stands for 3 glycerides attached to a fatty acid, okay? And then the last number, HDL, again, another one of those cholesterol numbers. Now, we don't take a whole lot of stock in like a cholesterol number, a piece by itself. Again, we look at the whole picture, okay? High density lipoproteins, those are technically, it's not cholesterol, they're carrier molecules for cholesterol. And what the HDL does is it brings cholesterol from the site of tissue damage back to the liver, okay, for it to be processed out and to be gotten rid of. And so when we have tissue damage, right, cholesterol needs to go to those areas to help to heal it, and then something needs to remove the oxidized or the bad, like cholesterol, back to the liver for it to be either recycled or completely gotten rid of. And so I hope that gives an idea of actually how inadequate your lab testing has probably been, and maybe a better understanding of why getting better testing is so important. Okay, I want you to follow through with some of these other videos. If this is already enough for you to say, hey man, like this is something I need to look into, gosh, set up an appointment with our office, because the lab testing for this isn't astronomically expensive, right? Again, I didn't get into some of the advanced testing, which we only do if we need to, which would be like your different testing for autoimmune problems, right? Specifically in regards to the pancreas itself. Stay tuned for the rest of the videos. That's all I have. I hope you look deeper. Thank you.